Ladies and gentlemen, my fellow Turks and Caicos Islanders, and all residents, good afternoon. Over the last few days, the number of positive COVID-19 cases have risen exponentially. On Sunday, June 28th, the authorities confirmed 13 new cases, which are in addition to the 12 cases we announced the previous day, bringing the total number of positive cases to 41 and active cases to 29. While the new figures are in and of themselves troubling, it however speaks to the success of the aggressive measures we have taken or have in place to manage the virus. We are satisfied that the elaborate system of contact tracing has worked well in this instance and that success has minimized the likelihood of further spread. The 13 new cases were discovered because of the success of our extensive contact tracing and was done following the finding that 11 of the 12 cases announced on Saturday past were as a result of a work-related activity where a number of persons were gathered. Not only are we prepared to say that it is work-related and it is not as a result of a party, we are also prepared to say that all of the active cases are on the island of Providenciales. What we are dealing with here is a significant outbreak on Providenciales linked to one major hotspot. This brings in focus the success of the overall strategy to build our island testing capability. Before we had that ability, people were identified during contact tracing but have been placed in quarantine and not tested unless they were symptomatic. With in-country testing and under our very own testing strategy, we were able to find positives that were asymptomatic. And because of this information, the entire society here in the Turks and Caicos is safer as a result because it allows us to take decisive measures to stop any community spread. In the past, the public would have seen the numbers in quarantine go up and a number for suspected cases because overseas laboratories would only test those who are symptomatic. In our new reality, you will not see suspected cases arise alongside quarantine numbers. But as we stand this afternoon, our hospital has capacity, and it is important to note that only one of the work cluster has had to be hospitalized, and this is because of underlying conditions. This latest development calls for reflection, great enforcement of measures we know have worked, greater vigilance, and greater discipline on everybody's part. What it does not call for is panic, and while there is need for serious concern, more importantly, there is greater need for vigilance. We are confident that the health authorities are on top of this matter, and once every one of us follows all the established protocols, we will continue to remain safe. Cabinet considered and determined that there was no need to invoke emergency powers. And given that there is an identifiable hotspot on Providenciales, we are therefore moving to take a series of actions specific to the island. The new measures contained in regulations have been made under the Public and Environmental Health Ordinance, which allows for a localized response. Following an emergency meeting of Cabinet on Sunday 28th, the following measures specific to Providenciales were agreed. 1. A curfew is imposed on the island of Providenciales from 10 p.m. to 5 a.m. every night starting tomorrow, June 30th, 2020, at 10 p.m. until 5 a.m. on July 13th, 2020, and guided by the stipulations set under the regulations. 2. We shall now delay the reopening of businesses which was slated for July 6, 2020. This will be delayed by a further week until July 13, 2020. These businesses we are talking about here includes hotels, dine-in restaurants, casinos, bars and discotheques, gyms, spas, and fitness centers. 3. Gatherings inclusive of churches, weddings, funerals, social gatherings will be once again limited to 10 persons, and that will remain in force until July 13th. As it relates to activities on a public beach, no gathering of not more than 10 persons outside the same household may be permitted at a beach. Fourthly, with immediate effect, we are delaying the recommencement of sporting events and contact sports until Monday, July 13, 2020, at 5 a.m. Fifthly, there will be an imposed restriction on travel from Providenciales. A person desirous of returning to his home in Providenciales may travel from any of the islands into Providenciales. However, from 30th June 2020 until 13th July 2020, except for essential travel, a person shall not be allowed to travel from Providenciales to any of the other islands. Commencing July 13, 2020, a person who is desirous of returning from Provo to an island he ordinarily resides on may travel from Providenciales to his home, provided that an airline shall maintain a travel log and reduce the number of persons to permit physical distancing. 6, we have also agreed for a greater scrutiny and prioritization of incoming repatriation flights to ensure adequate management of the capacity of public health officials to monitor the surveillance measures applied to persons under quarantine orders until July 13, 2020. In this regard, the Ministry of Health is to issue additional guidelines to the aviation industry and the public to govern the application for approval of flights. We must emphasize that all the new measures and extensions apply to only Providenciales. All the other islands will continue as they are and move to phase 3 on 6th July. While the focus right now remains on containing the spread in Providenciales, we also want to re-emphasize that cases can remain hidden and that people on the other islands must not operate from a place that the virus is not on their island. We note with serious concern the many false statements and allegations that are in circulation. And we know that one sure way not to be successful in a pandemic situation is to traffic in fear. Fear is as dangerous as our huge gatherings for not wearing masks or face coverings. Fear forces irrational actions on behalf of individuals who will ultimately put everyone at risk. We want to warn our people that false statements on matters like these also pose a threat to general public safety and well-being. There has also been some clamor for health officials to release details of the event and host where this cluster was that we are dealing with. This again is against best practice and against international guidelines, because in the end it will be counterproductive. It will lead to antisocial behavior of discriminating against those who already face the challenges of contracting the COVID-19, and it will send people who will otherwise be willing to cooperate as we continue contact tracing to go underground. Now more than ever, we have to be our brother's keepers by resisting the temptation of rumor, mongering, and stigmatization. Additionally, we must take personal responsibility to ensure that we continue to act responsibly and follow all protocols. Again, we know that the natural question would be as to whether there will be a delay of the start of phase 4, reopening of our borders. The issue about the reopening of the borders was discussed extensively at Sunday's cabinet meeting, where health officials were in attendance. Following these encounters, it was decided that as of now, we will keep that schedule. This is because the protocols governing arrivals when the borders are opened are so detailed and so strict that the risk of imported cases going through the system is mitigated. Of course, we accept that nothing in life you do is risk-free. The very act of getting here today had its own risk. But with our insistence that people who are traveling here must be tested at their place of origin before arriving, minimize the risk associated with the opening of the borders. Our mandate remains to keep our people safe while gradually and carefully returning to some level of commercial activity that will help sustain the economy of this community. Health and safety will always be our first priority. That is why we insist that the Cabinet on July 8th will further review all of the measures now in place and the likely impact on additional phased reopening. Managing a pandemic is never a static activity, so everything will come under further review then, including the reopening of the borders, which at this stage will continue as scheduled on July 22nd. We want to reemphasize to every resident in the Turks and Caicos Islands that it's crucially important that we follow all of health's protocols. These are put in place not to inconvenience anyone, but for the safety of everyone. We see through this current experience how the actions of a few has impacted an entire island. These last few days have taught us many lessons. They have also reminded us about the lessons that we had already learned. Maintaining the hygiene discipline works. Social distancing works. Not gathering in large numbers works. Wearing face masks in public works, and we will seek to strengthen our enforcement of the wearing of masks in public places and of the social distancing protocols. We are not pushing enforcement to make criminals of anyone, but to ensure that we keep each other safe. We must be more responsible in our very own actions and assist all of us by doing the right thing. As I conclude, I wish to reemphasize the following. Build on island testing allows us to understand and do more, and this has always been a central and key part of government strategy, so we understand more. We are able to relax measures in a controlled way so we can either move forward or back. We show how we can use different types of laws for the appropriateness and proportionality of the issue. What we are dealing with is a significant outbreak on Provo, linked primarily to a work cluster. Testing has identified the extent. Proportionate measures will now be applied. We know about these cases because of online testing. This is partly a story about the success of our independent capability. Separately, our hospitals still have significant capacity, but if that changes, so too will the measures we introduce. We have to again work together, Provo, as one island, where we are all dependent on each other. This is, of course, to protect our health, but also now to protect our economy. We have to work as one to make sure we can reopen on July 22nd. There is much work being done to protect us from the importation of the virus through mandatory pre-arrival testing. What we have to do is to prevent the spread of the on-island virus. There are significant lessons learned. The key point was that one single event brought together over 10 people when 10 people was the limit. And that now makes the contact tracing extremely challenging because the contacts from each individual fan out and touch others. As a result, we are very firm that the total number that may be presently gathered is 10, not a single person more. We need to observe this. I think it's worth emphasizing that for the first time, there's been a difference between the islands. And I must say that this is not a hall pass for all of the other islands, especially Grand Turk and North Caicos, where we know of social gatherings continuing. The example we have here shows that the virus can be among us hidden. Let this remain at the front of our minds. The last few days also reminded us about the dangers of letting our guards down. Over these last few months, we have won significant victories. We have effectively managed this pandemic, but the war has not been won. We will continue with the things that have worked so well, and we shall always remember that the price of progress is eternal vigilance. I must thank the heroes of this current exercise, the Ministry of Health and hospital staff, but especially the hard-working contact tracing team and those who cooperated fully by allowing themselves to be tested and by offering key information. We salute you, and these individuals remain a part of our best defense. God bless you all, and may God bless these beautiful by nature Turks and Caicos Islands. I will now invite Dr. Nadia Aswad, the Chief Medical Officer, to offer some remarks, and we will thereafter take a few questions.
Good evening, everyone. The Ministry of Health's most recent COVID-19 dashboard, which was published yesterday, the 29th of June, would have reflected that there have now been a total of 41 cases of COVID since the beginning of the pandemic. The TCI reported its first case of COVID-19 on March 23rd, and between this date up until the 22nd of June, we had reported a total of 12 cases, including one death. On June the 22nd, 2020, 2 positive cases were identified by the National Public Health Laboratory of the Ministry of Health. The first individual was a resident who was repatriated to the TCI and was tested as part of the quarantine protocol. This individual was asymptomatic and was already in quarantine at the time of testing. The second individual was from the community and was symptomatic when they presented to the healthcare facility and was subsequently tested and found to be positive. A total of 25 close or primary contacts and 3 secondary contacts were identified through contact tracing and were tested and quarantined. Of these individuals, 1 person tested positive. On June the 25th, a resident who attended an event was identified who was symptomatic. A test result was returned on the same day as positive for COVID-19. This individual has subsequently been hospitalized, and contact tracing was carried out by the public health team and revealed a total of 25 primary contacts and 67 secondary contacts who have all been quarantined. Of these, a total of 12 primary contacts and 11 secondary contacts have tested positive for COVID-19. Another symptomatic individual who is currently hospitalized has also tested positive for COVID-19. This person is being managed as an inpatient at the hospital. There is no clear epidemiological link to a confirmed case. Contact tracing efforts have revealed a total of 8 primary and 5 secondary contacts for this individual, and thus far 1 contact has tested positive. In total, 29 persons have tested positive for COVID-19 since June the 21st, with 2 of these individuals requiring hospitalization. Contact tracing is ongoing by the public health team, along with testing and active case finding through the health hotlines and referrals from health facilities. Although this sudden increase in the number of COVID-19 cases has been concerning, the rapid mobilization of the public health response has managed to quickly identify, test, and quarantine contacts as a mean of controlling and preventing further spread. I must commend the public health team, including the public health nurses, registered nurses, medical officers, environmental health staff, staff of the National Public Health Laboratory, and the National Epidemiology and Research Unit, who have been working tirelessly since these events transpired. Through their ongoing work and commitment, we have continued to track and trace individuals who may have been exposed to COVID-19. The events of the last few days will continue to evolve, and with the ongoing testing and contact tracing, it is expected that additional positive cases may be identified. We are grateful to have the assistance and the ability to test locally, which has really been a great support in rapidly identifying positive cases and taking quick action. This could not have been done without the support of the government, Public Health England, and our other colleagues. We are also grateful for the technical assistance that we are receiving from Public Health England and the Pan American Health Organization in response to these increasing cases. There are a few key messages I would like to emphasize for everyone who is listening or watching this evening. Firstly, please avoid speculation. Speculation and the spreading of rumors will only make this situation more challenging for everyone concerned. We would like persons to come forward who are experiencing any signs or symptoms of COVID-19. I don't want individuals not to come forward for fear of other persons talking about them or discriminating against them. I applaud all of the individuals who have come forward voluntarily and being tested. Through these actions, we were able to identify the disease and support these individuals while minimizing the risk to others. This can only be done in an environment where people do not fear coming forward and engaging with us in the healthcare sector. COVID-19 does not discriminate. It can affect any one of us. So please treat others as you would want to be treated. Stay informed. Get your information from credible sources. Information is readily available on the Ministry of Health's website and other reputable websites. Be aware of symptoms and signs of COVID-19, cough, shortness of breath, fever, diarrhea, loss of taste or smell. Know what you can do as an individual to stop the spread of COVID-19. Wash your hands often with soap and water. Practice social distancing of 6 feet between one another. Wear face coverings in public settings and in particular in environments where you cannot practice social distancing. Cover your cough or sneeze using your elbow or a tissue which you dispose of. If you are sick with a cough, fever, or shortness of breath, call the health hotlines 333-0911 or 232-9444. And if you're sick, please stay home and avoid contact with others. Please follow other public health guidance which would have been shared by the Honourable Premier earlier. Social gatherings are the ideal setting for spreading COVID. I understand the need and the desire to relax and socialize with friends and family. However, congregating and gathering in large groups is the ideal setting for spreading this virus. Social gatherings such as parties or other events, wherever they may be held, can cause people to let their guard down and forget the public health measures which we have been promoting over the last few months. Lastly, and most importantly, We cannot overcome COVID-19 without the assistance of every single person in this country. Each person plays an important role, and without the understanding of the general public and the compliance with all of the protective measures, we cannot effectively stop the spread of the disease. I am asking everyone not to be afraid, but to take the necessary actions which can protect yourselves, your loved ones, and the wider community. None of us should feel safe from this disease, but if we take precautions, which we have been provided with, we can stop the spread. Thank you.
Thank you. We'll now invite any questions you may have. I want to recognize that the Honorable Minister of Health is here as well, the Honorable Edwin Ostwood, the Honorable Karen Malcolm, the Honorable Darwa Williams, and the Honorable Gulri Ewing is also here with us. So any questions you may have for the Technocrat, Dr. Nadia Ostwood, and also the Minister with Responsibility, Honorable Edwin Ostwood, and I ask you to rise in your place so that I can know that you are the one that wants to be asking the question. I see you're with...
Oh, you went for the line L. The line L, Weekly News.
Okay, go ahead.
Maybe this is a question for Dr. Ostwood.
So can I ask you, can we take all of Dr. Ostwood's questions first?
Okay.
And then we'll take any questions here for the Minister of Health, and then you can take any questions for me. I'll be the last. So let's try to not have us back and forth for obvious reasons. All right, so we ask Dr. Ostwood to take any questions at this time.
Can you say how many of the new cases and also the old cases were asymptomatic, and how many were symptomatic?
Thank you for the question. It's an important question because, as the Premier stated earlier, through the ability to test, we are able to detect both symptomatic and asymptomatic cases. So in terms of asymptomatic cases, we had 69%, so 69% of the 29, and 31% were symptomatic. So it really is a credit to our ability to test locally that we were able to identify these asymptomatic persons who might have spread the disease to others unknowingly.
And just a follow-up, how many were from the new testing in the past week?
29.
29.
All
of them were asymptomatic?
No. 29 were identified over the last week. Of those, 31% were symptomatic.
Oh, can you give me a number for that?
Oh.
Please? Thanks.
Oh gosh. Okay. Gosh, I haven't got that one right now, sorry. Sorry, I'll have to provide that to you later. Sorry, I got my numbers as percentages, I apologize.
Thank you.
Okay, it's Todd Lean from the Sun newspaper. I'm not sure if the Premier wants to chime in on this as well, but there's one thing to tell people to do something, it is another thing for them to actually do it. I'm trying to find out, are you guys trying to find out if you want to implement fines as far as persons who are not abiding to the protocols, the safety protocols measures that are in place? Will there be any fines?
With the regulations that have been passed with the measures, there are enforcement areas that address if persons aren't compliant with those requirements. So yes, there are fines. Those things can be reported to the police, and there is a legal recourse for persons who are non-compliant for the rules that are in the legislation.
And just follow up to Todd Lean's question. The Premier mentioned...
Pardon me, even if you have follow-ups, can I ask you to allow the persons to be complete first? I notice you're passing around a microphone.
Yeah.
Can we ask you to stop that, please? We're going to try and get something that we can spray or wipe for you, but we want to encourage you not to do that. Please. If there's any other way we can improvise at this time, we must. So could you allow her to finish and allow the others? I'm sorry, I'm going to have to ask you to stick a pin so we can give everybody an opportunity, and then we'll do a final round.
Okay, Honorable Premier, I have a question for you.
No.
DeAndre Hamilton with Magnetic Media. When it comes to the hospitals, what is the capacity currently? and what are we working toward?
Thank you. Since the outbreak, we have been working on building hospital capacity. This has taken a number of forms in terms of a project which is commenced to uplift 6 additional beds in addition to the 20 beds at the hospital. So work is underway and progressing well with that. We would also have the Cuban medical contingent of 20 individuals. I'm pleased to say that they have come out of quarantine today. They have been undergoing orientation and training, and we are expecting them to supplement the team at the hospitals. And we are doing additional work in terms of the procurement of oxygen generators, which would see us being able to make our own medical grade oxygen for the first time in the Turks and Caicos, so that's a very exciting development. In addition, the hospital has been stockpiling oxygen as a backup until we can have that technology in place, and we are also in the process of procuring additional supplies and equipment which will support the additional bed space. So we are advanced in terms of the capacity that we are building in the health sector. This was one of the critical things that we really wanted to achieve. And then also we have to talk about the lab and the ability not to have to ship samples and receive results after 6 or 7 days.
So for Providenciales, 6 beds additionally.
Yes.
Yes. Grantor?
Grantor, we are now actively looking at that in terms of building additional bed capacity. As you would know, Grantor doesn't always operate at full occupancy, so we do have some leverage there in terms of the capacity. But we have seen that, you know, there is a potential to develop additional capacity in Grantor, so that is something that we are actively working on right now.
You mentioned earlier that we had some people who came forth voluntarily that you were able to test. How did that happen? What do you mean by voluntarily?
Well, we had persons, well, thank you for the question. We had persons who would have come to the clinic settings to present with symptoms and signs. I mean, ideally, it would have been better through the hotlines. And so we still encourage people to call the hotlines. But we are aware that people are reluctant to come forward, and hence my statements on stigma and discrimination, because we really don't want to have any barriers to persons engaging with us. It's better to call us even if you have mild symptoms, because we would like to assist you. We would like to be able to test you and give you that information, and we would like to support you should you become positive and then prevent any further spread.
What is the protocol for trainings at resorts, for example, as they ready? Because this had been one of the ideas floated at what is this group activity. So what sort of protocols has public health set up for trainings at resorts as they, you know, try to brace for the arrival of guests?
Thank you. The protocols would be the same as set out in the regulations. So it doesn't specify anything other than mass gatherings and the number of persons that can be in a group. So it doesn't specify, it's for all settings. And so in those guidelines, it clearly outlines the numbers of persons that can gather, and then there were a phased approach in terms of gradually increasing that number. So the timelines were set out in the regulations, and that is what is expected for everyone to comply with. So
With
there's
the same,
no,
sorry.
so there's no exception or variation for trainings, etc.
Right. And what about parties? Is parties allowed at 10 people, 25 people, or not at all at this time?
As the Premier would have announced, the number has gone back to 10 for the island of Providenciales. I have been personally very concerned by the images that I have seen of parties which are not just specific to the island of Providenciales. In those pictures, nobody was wearing a mask. When you drink alcohol, you are less inhibited, you're less likely to comply with social distancing and face coverings. So I really, want to emphasize to people that, these are, a virus can spread so easily, and that is why those measures in terms of physical distancing and face coverings are critical. At this particular time, because of the situation in Provo, the numbers have been reduced to 10. I really hope people adhere to it, because we have seen what non-compliance has resulted in, and that is why we're here today.
People are concerned about the quarantine and how people are actually behaving when we expect them to be responsible, sit out their quarantine time. Can you say to us how many people are in a government facility quarantine at this point?
Thank you. I mean, the numbers are published on the dashboard every day. So you would have the number of people in isolation or quarantine, and then it has the number who are quarantined at a facility. Last week, the Ministry of Health would have issued another press release on quarantine because we are concerned about even the compliance of people in the quarantine facilities. If we feel that persons are not going to comply in the community, they will be quarantined in the facility. We do have security there, but we really want each person to be responsible when they are issued with quarantine order, which is a written order and it's a legal document. It outlines what you should do when you're in quarantine and what you should not do. And so we wanted to remind everybody that the quarantine is a legal requirement. There are certain terms that are set out, and there is, as we said before, legal recourse if you're not compliant. We've seen in other countries they name and shame you, and we don't want to get to that stage, but we want people to take it very seriously when they are quarantined, and also persons in the public to refrain from visiting people who are in quarantine because you're putting other people at risk.
For clarification, what happens when our repatriation flight comes home? Are people temperature checked at the airport? Are they tested? Are they made to quarantine at home or in a facility? What happens precisely?
When there is a repatriation flight, the Ministry of Health is notified in advance. We obtain information whether the persons are able to quarantine at home. We want to know specific things. Are there any vulnerable people in their homes? Are they able to separate? Can they manage? Which island are they from? Because obviously if they come to Provo, they can't go to Grand Turk or South Caicos the same day. For those who quarantine in the facility, they can quarantine the facility. We share with them the quarantine order before they come so that they are aware of what is required. They are met by the public health team who do, they are required to submit to the health screening questionnaire. They have temperature checks done and they are issued with a quarantine order. If they are at the facility, they are under our management in terms of the facility, and then if they're in the community, they are also monitored by the public health team.
Right. And when it comes to the daycare centers, how are we going to manage that scenario? And it will now be at July 13th that we see those reopen?
Thank you. The daycare centers, we had issued guidelines in terms of all of the various measures that should be put in place. The Department of Environmental Health is working with education to ensure that all places, all businesses in general, are inspected prior to reopening to ensure that they are able to comply with the measures. If they fail that inspection, they are not allowed to open, so they need to demonstrate that they are able to comply with the guidelines.
Okay, I mean, but can you tell us, because to help us understand what's going to happen at a daycare, because we know with the local economy coming more fully on stream, whereas schools are on break, typically at this time, daycares really never take a break.
Thank you. The guidelines are actually on the Ministry of Health website. They've been there for a few weeks now. So when you go to the Ministry of Health website, there is a tab for guidance.
Yes.
On there, you have all the guidelines for all the various sectors, ports, hotels, accommodation sector, villas, scuba diving, seafaring, boating, sporting. You know, basically we have extensive guidelines which are available on the website, and we would have undertaken consultation with the relevant sectors to go through the guidelines and get their feedback. So they are there, they're publicly available for anybody who wants to have a look.
Okay, thanks for that. And finally, as a CMO, have you set sort of targets for testing when it comes to the community testing? Are we as a country saying we want to test everybody before July 22nd? Are we saying we want to get hospital and hoteliers or hospitality workers tested? What are our goals? What are our sort of benchmarks?
Thank you. You know, we have a testing strategy which we would have submitted. You know, the priority would be the persons who are sick or symptomatic, people who are traveling for treatment abroad, contacts of positive persons, as we've had to unfortunately exercise over these last few days, and then frontline workers. So we have already commenced frontline worker testing. We had issued a press release. We started with police and various sections of government, including healthcare workers who are on the front line, whether they are in the TCI hospital, whether they're in the private sector or the government sector, because these are the persons who are on the front line closely interacting with persons. So we are well underway with that testing. We've received a bit of a setback because of this current situation, but we are progressing that forward in terms of ensuring that those persons who closely interact with other people, especially potentially sick people, are tested. So that offer has been extended, and we are progressing on that nicely.
And I don't want to make an assumption, but I hear you say the Cuban team will assist us once we get these 6 beds, once we get our ventilator system or unit all going. So that's where our support is coming from for that specifically?
That is
Because I understand it's a specialized sort of skill to be able to use these these ventilators and respirators.
yes,
etc.
we in the Cuban contingency we have physicians and critical care nurses, so they will be deployed to support the staff at the hospitals and create a surge capacity in terms of staffing in order to respond to any increased need, or if there is any need in terms of the new beds that we're building into the hospital. So yes, they are our surge capacity.
Maybe this is a question for the minister, but I'll throw it at you anyway. This steroid, this is the last one, I promise. The steroid that's been talked about, that's been approved by UK as working in critical cases with COVID-19. Do we have it on island? Do we plan to use it? Do we endorse that?
We are well aware of the research which has been published about this. We received the technical brief from the Pan American Health Organization. We have shared it with the hospital. This is a drug that's part of, we normally have access to. But the situation with COVID is rapidly evolving. We see lots of different medications which are being proposed as cure-all. We saw what happened with chloroquine, unfortunately. So we are looking at the research which is evolving rapidly in terms of the search for treatment for COVID-19. So yes, we are aware of that. We have shared it. We are awaiting the findings of additional research. It's important for this research to be carried out in a rigorous way to see what can realistically be implemented, and also the main thing you want to keep at the forefront is the safety of patients. Thank you.
So before we go back to weekly news, is there anyone else that want to? Weekly news will take your final question.
Dr. Ashford, is there any sort of comparative analysis being done for the patients who've tested positive for COVID-19 in terms of sex, age, underlying issues, and so forth?
Yes, we have, sorry, it's a work in progress. We have done analysis on age and sex. The majority of patients are female. The majority are in the age group, I think in the 34 to 44 age group. This is similar to other countries in the region, so that middle set of age with a few outliers on the younger end and the older end. We are developing the information that we have, the epidemiological information, and we will be discussing that further. Before, it was very hard to do analysis when we had such a small number of cases. So we are working with Public Health England, who is working with our epidemiological team to develop the picture that we have been presented with over the last week with the data.
Thank you.
Are there any questions for the Minister of Health? I will ask.
I think all was covered by CMO, so I don't think no questions is still for me. Thank you very much. Thank you, Dr. Ashford, for such a wonderful report, and thank you, Madam Premier, for your address. But at this time, I just want to reiterate something that was said both by the Premier and Dr. Ashford. Stigma and discrimination. All of us who were in the health profession in the 90s at the apex of the AIDS epidemic, we saw how stigma and discrimination affected us in our treatment of HIV/AIDS. And only after the stigma and discrimination decreased, we were able to really get a hand on it. And right now, you're not even hearing people talk about HIV and AIDS, even though it's still out there. But I want persons to know the COVID-19, it presents flu-like symptoms, fever, flu. We do not discriminate against persons when they get the annual influenza flu during the Christmas time, January, February. So why are we doing it now? It is just a different virus that causes almost the same thing. The mode of transmission is the same way. It's just that one is more pathogenic than others, that it can infect people much quicker. But it's the same type of virus, a flu-causing virus. So if we do not discriminate against people when they get the flu, Christmas time every year, why are we doing it now? So I just want to tell us we need to put an end to stigma and discrimination when it comes to COVID-19. So that, and want to praise those persons who saw some symptoms, who have reached out to the Ministry of Health. it be that some of them came in, which they shouldn't have done, but nonetheless, they had presented themselves forward, say, hey, something may be wrong with me. I do not want to impact the community and my family. So please run the test on me and then let the necessary protocols take place. So artists, if you're feeling that way, reach out to the hotline. And I want to tell our population, cease and desist from stigma and discrimination. And last but not least, my people in Grand Turk and South Caicos, Middle and North Caicos, let's not let our guard down. These regulations are for providenciales today, but we don't know tomorrow it can be for another island. Thank you very much.
Question.
Yes.
Are we, because of what we're hearing about quarantine,
Yes.
and we know government is saying they're not prepared to really go into detail about maybe even misbehavior, are we prepared to introduce an app, track the individuals, since we're able to do it or considering it or will do it when it comes to our guests? What about our returning residents?
Yes. We had presentation to the Ministry of Health from 3 different companies. However, we were looking at the app and the data protection legislation, the use of that app, and tracking individuals, especially with our residents. A lot of our people, they live in other countries and they know the importance of privacy and the invasion of that privacy. So we need to get that data protection legislation first and look at how we track that app, because we don't want persons using the information to say, oh, the reporter was at this place, went at this person's house, they went to this person's house. Look how they're moving. They're not home. You think they should be home. Look, that must be her boyfriend's house. That must be her girl, you know. So we need to look at the data protection first before we really roll out that app. But we have gotten the presentations from 3 different companies, 2 local and 1 from the region about the apps. And we are looking at that along with the data protection legislation.
How do you feel about the violators? What are you prepared to say, to do specifically as the minister to make sure people who are flouting these social distancing and other health protocols are dealt with firmly? Because I mean, look at the impact. 12 cases hopped to 41 cases in nanoseconds.
Well, we at the ministry, come July 1st, we're going to have a COVID-19 task force, right? It's July 1st. And we want those persons will be tasked with going out into the communities, spot checking on restaurants, hair salons, other gatherings, places where they sell food, hardware stores.
Parties?
Parties, wherever people are gathering. They're going to be all over the place. Our COVID-19 task force. I know we have to increase that. Dr. Aso, do you have the numbers? How much we're going to be employing? But the bulk of it is going to be here in Providenciales. So from July 1st, we're going to have that task force out and about to give citations, to tell people, to warn them, look, you are in violation. This can happen to you. If you cease and desist, we can call the police if we need backup. You know, if you don't put on your mask and you're going into the store and you're making a huge fuss, those things. We're going to have that task force out and about in the communities to ensure that persons adhere, at least adhere, and remind them the need to adhere to these guidelines in terms of social distancing and wearing of masks.
Why wasn't a task force out before, since the economy started to reopen since earlier in June?
To recruit?
No, since the economy started to reopen earlier in June,
Just
why wasn't
expanding
it put in
numbers.
place since
Just
then?
expanding numbers now.
Yes.
Sorry?
Yes, before that was being done between the public and environmental health, we had other professionals doing that, but now we want a specific task force so that our public and environmental health officers, our public health nurses, they can be utilized in contact tracing and other aspects of the epidemic. But we want this task force is going to be strictly to go out and about and deal with these issues.
So
And we have done the recruitment. We had to get the job description prepared, recruitment, go through the normal process, speed it up, and now we have those persons. Persons had to apply, be interviewed, and now they're ready to roll out.
So that would encompass what departments? The health ministry, police?
No, this is Ministry of Health. This is a
It's
task
Ministry of
force.
Health Task Force?
Yes, a Ministry of Health. This is
And
in the
if it-
Ministry of Health.
If
Would you
you
let
need
him
help from
finish?
the police?
Allow him to finish?
Yes.
Before you
Yes. It is not a task force like the Customs Immigration where we're pulling from all areas. This is a Ministry of Health task force that a niche department that we are developing to assist our team and ensuring that the regulations are adhered to. So it's not pulling from the other ministries. We had to look at that first, and we're going to bring in persons who were not working to come in. But now that the country is opening up and people are getting back to work, those offices will not be available. So we decided to go in a different direction and create jobs, create opportunities, training, step in for young people, older people, persons who are unemployed. They can join the Ministry of Health task force, and this task force will be situated in the Ministry of Health.
We understand that face masks are to be worn until the end of the year at least.
Yes.
Yes. This is going to be for guests as well?
Yes, ma'am. And we're not going to be crazy about it that if you're, for instance, lying on a beach by yourself or taking a jog over the hills that you need to wear face masks. But once you go in, as the regulation states, into any public area, any business, you need to wear your face mask. And we're hoping that all guests who come here will adhere by our laws and guidelines.
So let me just, I don't know the enforcement, but I think people know that I'm especially interested in enforcement. To say in response to the weekly news question, there was no need to have the expanded numbers. As the minister said, the economy was closed, the local economy was closed. As we pick up with activity reopening, of course, then we need to expand the numbers that have been out. And again, we did use a number of civil servants who were not back to work or not fully engaged in that task force. We're now calling it a task force, but you would see regulations before where we even used them in the opening of the construction industry. We had labor inspectors helping planning. So that's how we use civil servants who were not actually engaged in their offices.
My question, I pose the question particularly because I know quite a few businesses that have not been following the protocols. Masks, no social distancing, opening, serving people coming, sitting, dining, that kind of thing. And police are just driving up and down the road and nobody's enforcing anything.
Well,
Hence my question.
I assure you, things must change. We've gotten those, I'm going to praise the public. I have to praise the public because the public became the police. I tell you, there have been people who have been outing children on a basketball court. They are there now, send the police now. Or they're on the soccer field, send them now. So I want to encourage that. I really want to encourage that. So we don't have a hotline, but people have already reached out to persons and said, well, this is what is happening and it needs to be broken up. And we've been getting a lot of tips and we need to continue that. But the mask wearing is extremely important. Dr. Asford and her team is going to issue further guidelines because we don't want people to keep the mask on all day. If you're alone, if you're in your car alone, please, for goodness sake, give yourself a break if you're in the car alone, right? So we want to issue further guidelines, but we will be reinforcing the wearing of masks because it is still, as much as we don't know about this virus, we do know that that is still one of our best defenses.
Thank you.
So I'll take any questions for me now.
Yeah, I'd like to hear from you as well, Madam Premier, on the parties on these, because not just the one that we probably saw on social media recently, but after seeing that, I received reports that there are numerous parties around, and that just there isn't that enforcement. What happens? Yeah, what happens to these individuals? I mean, I don't know what the law says their fine or their penalty is. Do we know at this point? Do we know? I mean, do you know right off what's the penalty?
No, I don't know right off what the penalties are, but if you look at every regulation that we pass, there's an obstruction, there's enforcement, and then that tells you anyone who's in violation of any of these provisions, that's what the penalty is set up. But at the end of the day, there's enforcement that has to be strengthened. So I would have said that in the presentation, particularly with social distancing. So the COVID-19 task force, which the minister speaks of, he says we can call the police for backup, but the police will also be fully engaged in policing these protocols. The parties are very worrisome, and I don't want the islands outside of Providenciales to think that we don't know that they were doing it as well. But I think this experience, though it's work-related, still shows how easy we can fall afoul. And these were 10 people in a work setting. But 10 people, we've heard the numbers, how it ballooned for what who those persons would have been in contact with. That's the challenge for contact tracing. So when you look at the numbers, even with who's quarantined in a facility and quarantined at home, those are difficult to manage with a public health team who has to continue to manage them. So when we see as well the regulation that I would have announced today, that the CMO and her team will be looking to see how we can regulate even closer flights that are coming in to make sure we can manage what is happening for those persons who are in quarantine. We have heard of some of the bad behavior. We've actually seen people film some of the bad behavior. We've actually had people who were quarantined at home, met by family members and embraced publicly. You know, those are the kind of things that that impacted other countries in the worst kind of way. I can say that the returning resident was a return from the US. Please have mercy on our students. It is not them. We haven't had any positives out of that. They were tested before they left the facility, and they are good and well where they are now. So I just want to dispel that as well. So the good news about the returning resident who came from the United States, they were already in quarantine, as is required for returning residents, and they were tested there. But asymptomatic at the time, but tested because of our protocols.
I have a couple of questions if you want just coming in over WhatsApp. Is that okay? Yep.
So give the others who are here first.
Yeah.
Anyone else has any other questions?
Mine were answered.
Okay, this is interesting. We have questions from WhatsApp now.
Yeah.
And which media house they are with?
They are with
Let's
Joe
go right
Public.
ahead.
Joe
So we'll
Public
give you
FM.
we'll give you about 5 more questions, and then we
There's
have
just
to
about,
really
there's just
just
about
go.
3 of them.
Well, if you have 3, maybe other persons, and then we'd have to wrap up, as this is a fluid situation. I wanted to bring the health experts for you to ask whatever questions you would want of them. So let's go.
So the question is about face shields and scarves. Are they acceptable when entering public spaces? Is this okay?
Yes, so if you notice, our rule says face mask / face coverings. It's important. If you're over 65, if you're on front line, we don't say face covering for you. We say mask. That's N95. That's important. Those frontline persons, those persons with underlying conditions, that's important. But we recognize the economic situation as well. So we go to the store and we see the cowboys with the scarf now wrapped around their face. That's good enough. Because what you're trying to do is cover your nose and your mouth.
CXC examinations, how will they be handled?
Now, why would you do that? We have the lovely Minister of Education here. So I would take my questions, I'll take them and then I'll wrap it up. But I do know that there's been continuous meetings. They are supposed to be proceeding. I don't have, on the 13th.
13th of July.
Okay, 13th of July. I know that they kept having meetings, and because this is fluid, everyone keeps meeting. So it is continuing on the 13th of July.
Premier, how do you feel about the crime happening, especially during a pandemic like this? Every day is some attempted murder or something.
No, man, don't say every day. I rebuke that.
Well,
Oh Lord, I'm sorry, I'm national.
It seems like that.
No,
What
it's
do you
not.
have to
It's
say
not.
about it?
It's not. The thing about it is, I'm glad you say this. Let me also address what is happening in the prison very clearly as well. We are going through a period where a number of our Caribbean nations are going through with the same demographics. It is just incomprehensible that persons can't resolve differences in a more civil way. Okay, let's go back to school. I know I'm the leader of a country now, but when you fought when you were in school, you throw a rock whether it hit the person or not, that was the end of the fight. You have guys that will keep the same response, and a lot of these we do know, so I'm not talking or turn out retaliatory. They keep the same pitch, the same fever, even months later, and they will catch you wherever you are. That sort of crime we can't police against. We can't really enforce that because it's spontaneous. I'm going to catch you wherever you are, though it is somewhat premeditated. It is extremely concerning because we have to remember today we have a person who's occupying a hospital bed that who knows we may actually need. So when you look at the curfew doesn't just speak about stopping people's movements, but it also reduces the opportunity for us to have to use hospital beds because accidents happen at a particular time in the evening. And this is what crime does even in COVID-19. It causes us to lose hospital capability, but it also causes a sense of fear for persons who they know are home because of the shelter in place or the curfew. So it's a real dangerous and difficult position we found ourselves in. a number of countries have seen greater spikes. For us, it is still unfortunate because we are at the numbers now where we were for all of last year. And that is extremely concerning for us as a government. And I say to you, because what is playing out in the streets plays out in the prison. And it's very difficult with a crumbling infrastructure to begin to continue to manage persons who have beef with each other, and that's what we see playing. Now, I do know people are concerned as we are. The Honorable Ewing here is responsible for the prison with the video footage and the Hennessy and all of these things. We're grateful for the police for the deep down search that was carried out the other day that, as usual, when we have police raids everywhere, allow them to recover a lot of things that should have been banned. So we are working on additional initiatives, which I wouldn't say. We'll see less and less of that. But we are working again and progressing now the works of the Yellow Wing, which we lost in 2017 hurricanes. It took a long time, but we're there. And that will help us in terms of managing the space. So a lot of the times when you see the retaliation, as we had the other day, it is still what happened out here, trying to play out in a smaller space. So we are concerned about crime, we're concerned about the young man behavior even in the prison, and we know the country itself is concerned. All right, so I'll take, is this a WhatsApp question or is this a magnetic media question?
It's a WhatsApp.
Okay, there you go. And then I'll have a final comment.
Okay. So there are apparently cancellations, concerns, because the time frame of 72 hours for guests seems too tight. Is there any thought, anything being discussed at this stage about expanding that to a few more days prior to travel?
You expand it to a few more days and you're going to have an even greater risk. Imagine a person, you expand it to 5 or 7 days and they still go back about their normal life. You're still importing a greater risk for this country. At the end of the day, testing is not as difficult. Some of our source markets, but when the Ministry of Tourism and the Ministry of Health did this work, it didn't happen over a week or two. It happened over a considerable amount of time, looking at testing availability in our source markets, looking at travel insurance, whether it's readily available. We explored all of it together with the CTO and other Caribbean countries. We've had countries that moved away from pre-testing, and now we have, for example, the Bahamas considering it again. But the closer you get to the travel date, it's the safer for the jurisdiction. At the end of the day, that's what we're trying to achieve. And we know that there are testing options that are available. Tourism has carried out these consultations, and we're making them available, but they are going back again. We wanted to test the responses and the feedback, and they are going back in terms of consultation. But 5 to 7 days out, it will make a nonsense of asking people to test before they come here. Because you can't walk out from 5 or 7 days to a vacation unless you're self-quarantined at home. You're still bringing a great risk. All right? So thank you. I want to also take this time to extend sympathy to the family of the late Austin Robinson, former Speaker of the House of Assembly, and I do so on behalf of the government and the people of the Turks and Caicos. So I want to thank each and every one of you for responding positively, members of the media, and those of you who are watching. And please, we want you to be responsible with your information. We absolutely want you to be looking to only credible sites, but above all, please recognize how the actions of one or two has impacted an entire island. But again, as the Minister of Health has said, if we have to do this in another island, we would. So we want you to consider abandoning any risky behavior, stick to social distancing, make sure you're wearing masks, make sure you wash your hands, and you sanitize. All of the protocols that health has asked. And above all, if you're feeling ill, please call the hotline. We've been fortunate, though people have presented themselves, great care was taken to receive them. And we have to remember that we have limited hospital capacity. We can't have persons presenting themselves to the hospital, putting the entire staff at risk. But if you're sick, please do not stay home. It's important that you continue to reach out to the Ministry of Health. So God bless each and every one.
You taking any questions on Honorable Haley?